The detection of postpartum depression can be challenging. Depressive symptoms such as fatigue, weight change, sleep disturbances, and an inability to focus are often misinterpreted as part of a normal adjustment. The detection of postpartum depression can be challenging. Depressive symptoms such as fatigue, weight change, sleep disturbances, and an inability to focus are often misinterpreted as part of the normal adjustment to parenthood. Since these symptoms are common when one is caring for a newborn, some issues that nurses and providers can face are assessments and screening. Nursing assessment of postpartum involves including both objective and subjective data to evaluate the mother's psychological state. Given the multiple risk factors for postpartum depression, a thorough biophysical assessment must be performed. Symptoms and clinical manifestations. Alright, enough. The detection of postpartum depression can be challenging. Depressive symptoms such as fatigue, weight change, sleep disturbances, and inability to focus are often misinterpreted as part of a normal adjustment to parenthood. Since these symptoms are common when one is caring for a newborn, some issues that nurses and providers can face are assessment and screening. Nursing assessment of postpartum involves collecting both objective and subjective data to evaluate the mother's psychological state. Given the multiple risk factors for postpartum depression, a thorough biophysical social assessment must be performed. Symptoms and clinical manifestations of major depression, along with any family or personal history of depression, should be documented. Socioeconomic barriers such as financial constraints, lack of transportation, and the lack of childcare should also be noted. All maternal vulnerabilities need to be recognized to ensure family intervention and referral. A concern that when it comes to diagnosing postpartum depression is that nurses had a basic knowledge of postpartum depression, but they were unaware of postpartum blues as a different disorder and confused the two. Screening tools for healthcare settings are an important component of recommended depression treatment guidelines and of the provision of mental health services. The American College of Obstetricians and Gynecologists recommends 7 screening tests that have been validated for the use during pregnancy and the postpartum period, which are the Edinburgh Postnatal Depression Scale, the Postpartum Depression Screening Scale, the Patient Health Questionnaire, the Beck Depression Inventory, the Beck Depression Inventory 2, the Center of Epidemiologic Studies Depression Scale, and the Zung Self-Rating Depression Scale. Screening is recommended from birth to 1 year. In the last few birthing centers that I've worked at, there have not been any questionnaires done to detect postpartum depression. Questionnaires should be given at the time when the new mom are filled out the paperwork for their new bundle of joy. The only problem with doing a questionnaire is that new moms may not get the questionnaire by email or mail, but they may not have enough time to do it when they get home because they'll be too busy caring for their infant. Let's try this again.